to our channel. Today we're diving into the respiratory system, one of the most vital systems in the human body. The respiratory system is responsible for delivering oxygen to the body and removing carbon dioxide, two critical processes for survival. In this video, we'll explore how this amazing system functions, discuss common respiratory disorders like asthma and COPD, and introduce the latest treatments, including cutting-edge monoclonal antibodies that are revolutionizing respiratory care. Stay tuned! The first class to discuss is bronchodilators, which are a class of drugs used to relax and dilate the bronchial airways, making it easier to breathe. They are further divided in 2,1-beta, 2 agonists, 2 anticholinergics, 3 methylxanthines. Let's talk about beta-2 agonists, which involves in stimulation of beta-2 adrenergic receptors, which are primarily located on the smooth muscle cells of the bronchi. Increase CAMP levels, leading to smooth muscle relaxation, bronchodilation, and improved airflow. Beta-2 agonists, short-acting, SABA, provide quick relief from acute bronchospasm. Examples: albuterol, levolbuterol, perbuterol. Long-acting, LABA, used for maintenance therapy to prevent bronchospasm over a longer duration. Examples: salmeterol, arformoterol, formoterol, indacaterol. Uses of SABA are prevention of exercise. Induced bronchospasm uses of LABA are maintenance therapy, usually in combination with inhaled corticosteroids. Side effects of SABA are tachycardia, palpitations, tremors. Side effects of LABA, tachycardia, less frequent. Anxiety, less common, palpitations. Mnemonics of SABA are all little people. LABA is some friends are interesting. Next is anticholinergics, which show action by blocking muscarinic receptors and decrease mucus production in the airways. Uses are in COPD and asthma, acute respiratory distress, allergic rhinitis, and rhinorrhea, bronchospasm prevention. Short-acting muscarinic antagonists, SAMAs, used for quick relief of bronchospasm in COPD and as adjunct therapy in acute asthma exacerbations. Examples: 1. Ipratropium bromide, 2. Oxytropium bromide, long-acting muscarinic antagonists, LAMAs used for long-term maintenance treatment of COPD and asthma to improve lung function and reduce exacerbations. Examples: 1. Tiotropium, 2. Aclidinium, 3. Glycopyrrolate, 4. Rivafenacin. Side effects of SAMAs are dry mouth, cough, headache, dizziness, nausea. Side effects of LAMAs are dry mouth, constipation, urinary retention, blurred vision, risk of pneumonia. Mnemonics of SAMAs are I ought to breathe. Mnemonics of LAMAs are T-air glows radiantly. Next is methylxanthines, which action by 1. Inhibition of phosphodiesterase 2 adenosine receptor antagonism. Uses are 1. Asthma, 2. Chronic obstructive pulmonary disease, 3. Apnea of prematurity, 4. Acute asthma exacerbations, 5. Exercise-induced bronchospasm, 6. Adjunctive therapy in respiratory conditions. Examples are theophylline, aminophylline, caffeine, theobromine. Side effects are nausea, diarrhea, tachycardia, hypotension, insomnia, dyspnea, urticaria, hyperglycemia, renal impairment, increased urine output, angioedema, anemia. Mnemonics are tasty aromas, complete treatments. Next class to discuss is corticosteroids, which action by 1 gene. Regulation, 2. Anti-inflammatory effects, 3. Bronchodilation, 4. Reduction of mucus production. Uses of corticosteroids are in 1. Asthma, 2. COPD, 3. Allergic rhinitis, 4. Eosinophilic pneumonia, 5. Acute exacerbations of asthma and COPD. Examples of corticosteroids: 1. Inhaled corticosteroids are fluticasone, budesonide, beclomethasone, mometasone, cyclophenide. 2 systemic corticosteroids are prednisone, methylprednisolone, dexamethasone. 3 nasal corticosteroids are fluticasone, mometasone, budesonide. Different side effects are seen in different systems with the use of corticosteroids as mentioned. Mnemonics of 1. Inhaled. Corticosteroids are fluffy bunnies make clouds. 2. Systemic corticosteroids are please make dinner happy. 3. Nasal corticosteroids are frogs make bright tunes. Next class to discuss is leukotriene modifiers, which action by 1 leukotriene receptor, antagonism 2 inhibition of leukotriene synthesis. Uses of this class is in 1 asthma, 2 allergic rhinitis, 3 exercise-induced bronchoconstriction, 4 COPD. Examples are montelukast, zafirlukast, xyloton. Different side effects are seen on different systems with leukotriene modifiers. Mnemonics are many zebras, zip. Neat class is mast cell stabilizers, which action by inhibition of mast cell degranulation, blocking calcium channels, reduction of inflammatory mediators. Uses of mast cells stabilizers are in 1 asthma, 2 allergic rhinitis, 3 conjunctivitis, 4 food allergies. Examples of mast cell stabilizers are cromolyn sodium and nedochromal sodium. Side effects of mast cell stabilizers are cough, rash, itching, nausea, dry mouth, headache, eye irritation, dry eyes. Mnemonics of this class is nice calmers. Next class is monoclonal antibodies 1, targeting inflammatory pathways in asthma and COPD 2, neutralizing pathogens in viral infections 3, reducing inflammatory complications in severe respiratory disease, COVID-19. Monoclonal antibodies are used in asthma, chronic obstructive pulmonary disease, COPD, respiratory syncytial virus, RSV, COVID-19, autoimmune lung diseases. Monoclonal antibodies are used in asthma, chronic obstructive pulmonary disease, COPD, respiratory syncytial virus, RSV, COVID-19, autoimmune lung diseases. Different side effects are seen with use of monoclonal antibodies as mentioned. Different mnemonics of this class, on my bike, riding down, prevent new RSV, COVID inhibitors, treat severe respiratory. Thanks for watching. Don't forget to like, share and subscribe.